the Ministry of Information, where there is an update of our case management of COVID.
Let me see, I think. Sorry. Our active cases stands at 1,320. But you can see the regional breakdown. The significant number of all the cases, about 861 of them, is from Greater Accra alone. So accounting for almost over 70 to 80% of all the cases. We've following about 3,835 cases. The number of hospital beds, this is not the number of people in the hospital, the number of hospital beds available. Still, our hospitalization is very, very low, as I mentioned earlier. We have 926 beds available in case of a surge. Our isolation capacity is 744 across the country. Greater Accra has 140 now because we are no more using the Pentecost Convention Center, which was given about 600 beds. We have about 67 ICU beds for COVID, and we have 259 locations for quarantine. So this is just giving us the level of our preparedness as a country. Even though we are rising, we don't have high hospitalization and number of critical cases. So this is where we are all going to ensure that we work towards bringing these numbers down. We've also done something about face masks. I'm sure we shared it here before. We had done a series of almost 7 surveys in Ghana, mainly in Accra. The regions have done that, but this surge is currently in Accra, and so we are focusing more in Accra. Now, of that, the sample so far we've done, total sample size is about 95,372 people have been surveyed. And the first one was in August, and all the way, the latest one was in early October when we did the survey. As we had mentioned earlier, we did Aboagye, Makola, Kaneshi, Malata, Tema Community 1, and Ashama were the carriers. We did that. We also did some shopping malls in Accra Mall, ANC Mall, West Hills Mall, St. Junction Mall. We had also done an assessment in the streets and lorry parks across the country in the area that had been mentioned, and also have followed people on some trotro route to see what's really happening as people move. The next slide shows that we have number wearing masks, not wearing masks at all, wearing masks correctly, not wearing accurately, and wearing masks correctly. You can see that those wearing masks correctly moved from 44% in survey 3, that's when we hit the highest rate, to almost 10%, but in some areas it was as low as 5%. But the average was 10%, but there were some significant areas that we had about 5% wearing of masks. We had also seen that people who were not wearing masks at all had moved all the way to 72% of people are not wearing masks at all. And then those who were wearing masks but not wearing them correctly had declined, which means that's a little improvement, that people have learned how to wear the mask. But that was still just about, if you have only 72% not wearing, that tells you are still dealing with a very small proportion of the population appropriately wearing masks. So in summary, what we say is that the decline had appropriate mask wearing had declined from 44.3% to 10%, and in some settings, 5%. Those not wearing masks at all had increased from 18% to 72%, which is a major worry. And these are all in Accra, which is where the epicenter of the focus is. However, there has been some moderate increase in people who are wearing the mask correctly. What it tells us is that people are learning how to wear the mask well, but people have also stopped wearing the mask. And so I believe that if you're able to get people to wear the mask, more people will be wearing it correctly, and that will lead to better results for us. One area has been the airport. As you are aware, on the 1st of September, the airport was open to allow, but we had the 2-stage testing, which is you have a negative PCR before you board your plane to Ghana, and when you arrive, we test you. This is done not to eliminate risk, but to also reduce the risk as much as possible. Because we know that you can be negative today, but be positive tomorrow, and that's why we have a two-stage testing done. That so far, I've tested about 53,659 since the airport opened. We have recorded about 178 positives on arrival, despite the fact that they travel with a negative PCR before getting in here. 53,480 were negative. But the important thing that we need to look at is the fact that in September, we recorded the whole month 46 cases. In October, we recorded 98 cases, and that is telling you that it is the surge in Europe and America that was spilling into the country. As of now, today is the 9th of November, we have already picked 34 cases. That tells you that the strategy is working, and as it's identifying cases who otherwise would have gotten into the country and spread it. If you move to the next slide, not this one, the majority of them are males in the travelers. But you can see that a significant number of the positive I received have come from the US, UK, and Nigeria in the order as you see. And so that tells us the risk levels that we are dealing with. And so that also gives an indication of where we need to be more careful and follow up. And so in a nutshell, before Dr. Siedu comes in, the rise in the COVID cases is largely from Greater Accra. The imported cases are detected in Kolebu, the Kotoka International Airport is helping, is part of the number. The focal outbreaks in some nursing training in Brekum, which accounted for about 83, and actually plus 19. Followed subsequently. So over nearly 100 plus came from Brunhafu. The 14, I would say even the 15 regions are currently contained because the Bono issue is currently under control and there's no further spread. But there's no apparent increase in hospitalization at all. I think we'll but as a summary, is there non-adherence to protocol is a major factor in the situation we are finding ourselves now. And then, so I'll let Dr. Siedu do the rest, and I'll come and conclude. Thank you.
Before Dr. Siedu comes up, just for emphasis, I want to show back up on the screen about 3 slides. One of the first slides, that shows the difference between the first 2 weeks in October and the second 2 weeks in October. 1st to 14th of October, about 400 and something new cases, and then 15th to the end of October, that's where you see a sudden spike. Are you able to project that for us? And then I would also ask you to show us the mask survey results, and then we would pay some attention to the airport test numbers, just for some emphasis. No, not this slide. There is one that specifically outlines 1st to 14th of October, and then 15th to the end of October. And it shows clearly that getting to the end of October, the numbers, or the number of new cases being recorded, is literally doubled. Getting to the end of October. And if you compare that with the mask wearing data, so last night the president explained that though those who are studying the makeup of the virus are quite clear that the genetic makeup of the virus has not changed. The observation is that this spike at the end of October, which the data shows is in the Greater Accra region, or is mostly concentrated in the Greater Accra region, is grossly as a result of non-compliance with the preventive protocol of wearing the mask. And that is why His Excellency the President is reiterating that admonition to the people of Ghana that do well to wear the masks when you are leaving home. This morning we will reiterate a call to the security agencies and to the managers, particularly of enclosed places, to ensure that compliance with the wearing of masks at least is enforced. All of us as citizens have a responsibility to ensure that the other parts of it, where, washing our hands, using of the hand sanitizer, we do it. But particular call goes out to the security agencies and the operators of enclosed places to ensure that the wearing of masks is enforced. So if you look at this particular slide, 1st to 14th of October, 432 new cases. And then in the last 2 weeks of October, that's where the challenge has been, 1,229 new cases. Quickly move to the survey on the wearing of masks. Now, this is the data that explains why that challenge is coming up. And there are 3 clear lines. The blue line shows those who are not wearing the mask at all. The orange line is those who are wearing the mask but not wearing it correctly. And then I think the green line shows those who are wearing the mask correctly. It's becoming obvious that in October, and particularly in the last 2 weeks of October, those who are not wearing the mask at all is increasing. And this is the data that backs why the President is making that call and why we're asking the security agencies and the operators of enclosed spaces to ensure that there's compliance. Please go back to the graph. Then you'll find that those who are wearing it correctly is actually coming down. Even though those who are not wearing it correctly is come down, and you see a marginal uptick that for those who are wearing it, there's a shift. People are beginning to wear it correctly, but the majority of people are not wearing it at all. And that is why that call is going out, that it is important for all of us, especially those who operate enclosed spaces, workplaces in particular, places where people gather in enclosed places, to ensure that the wearing of masks is complied with. I want to invite Dr. Siedu Bekwin to now give us a detail of the Accra-specific challenge and what else is being done to ensure that a second wave is avoided. Doc, we're in your hands.
Thank you very much. So I think if you look at this particular outbreak, Greater Accra region has had persistent high numbers since we started from March. So over the past 2 weeks, we have seen that we have moved from an average of about 25 cases a day to about 101 cases. And Accra, that has 29 districts, apparently has all of the districts reporting increasing cases. But there's an emphasis on a district called Ayawaso West, and we need to explain what is happening in Ayawaso West. So if you look at the data for the past, let's say 2 months, Ayawaso West has reported 600 cases. But it's not that the cases are actually resident in Ayawaso West. What is happening is that we have 5 main labs that are situated in Ayawaso West. So these are the Noguchi Lab, Nyahu Medical Laboratory, MDS Lancet, CSR Laboratory, and Let-In Laboratory. These labs actually do the test there. And so actually areas that the test is recorded. So it's not place of residence of the cases. So I think that we need to make that clarity that Ayawaso is not an epicenter, but it's a center for testing. So if you look at the data, it says that clearly less than 10% of the positive cases in Ayawaso are actually resident in Ayawaso West. The rest actually come from other districts and then even from other regions. So the next slide. So the next slide tries to look at the test that has been done for September and October. And for September, you realize that we've done 4,813, of which 343 are positive. But then it's only 10 of them that are actually residents in Ayawaso. So that's just a little less than 3%. And then for October, we've done 4,390. And then the 257 were positive with a positivity of 5.8, but it's only 18, which is 7% that are resident in Ayawaso West. So clearly, the emphasis is not so much about people resident in Ayawaso, but because the tests are actually being done there. And I think that we need to put some clarity on a number of issues. I think that for now, globally, there's not been any known vaccine or any known creative agents to address COVID-19. So clearly, we are focusing on the safety protocols, and I think it has not changed. It's about appropriate wearing of the face mask. And I think, as DG said, people may have the face mask, but it will never be covering their nose and mouth. So it's about effective and proper use of the face mask, and then the hand hygiene and the social distancing. So these three strategies have never changed. But then what is happening is that there are quite a number of workplaces in Accra that we are having quite a number of infections going on. So this slide tells you of some workplaces in Ablekuma North, Ladere Kotupong, Ablekuma South, Kole Klote, Ningo, Prampram, who have actually recorded almost 100 confirmed cases. So these results gives a positivity of almost 32%, and of which quite a number have recovered. But the interesting thing is, how are the cases picked in these workplaces, and how are they managed? And I think that is the crux of a matter we want to discuss. So you may have a company called A, and one worker start having cough, sore throat, and then he thinks that he has a COVID. Maybe he may do the test, and then before I realize, the person is positive. This person never informs anybody in the health system. He tells the HR because he wants to get his salary or whatever. So the HR now arranges for a private lab. A lab now goes to this company, and then they start doing testing. So all I'm saying is that there's a whole arrangement which is taking place without recourse to the setup. If you look at the current system of what we operate, Ghana is using the 3 T's, which is a test, the trace, and the treat. So the testing, where is the testing done? The testing may be done in a public lab or may be done in a private lab. But somehow, you need to be directed to do a test. So if you do a test, and let's say you are positive, the issue is that there are people that you have gotten into contact with, who we call the contacts. So these contacts may be in your workplace or may even be in your household. And these are people who need to be identified, and then they trace and they are tested. What is missing in the current setup is that as we introduce a lot of these labs, the companies ignore our setup. So we may have people who are positive, their contacts are never identified by anybody, and they keep on going to work, even not telling anybody at all. So there are potential cases, and they keep on reinfecting. And I think that this is one thing that is causing a lot of challenges for our arrangement. Originally, before you are even tested, is the health system that suspects you. So the health system has information about you as a case. If you become a confirmed case, then they will now come to you and identify which people you are working with. So that clearly the whole process of contact tracing is composite. Contact tracing actually is 3 components of it. There's a contact identification, very, very important. Because if we are here, we are about 50, and we have all been exposed, and we decide to work on only 10, it means that the 40 people are potential risk of infection in the country. And I think that that is one thing that which we are having a challenge that we need to be able to address. It's about being able to identify the contacts of a case. So it is not about trying to save your company. As you try to save your company, you may get a big situation. What we do is that when the health system is informed, the health system comes to the organization or the institution and identify who are the contacts. So we do kind of a risk assessment. And by the risk assessment, you know who are the close contacts of this particular case, and then you are followed through, and then you do a test, and then by the end of day 14, you are discharged if you are negative. So I think that this is something very important that we need to stress with. So I think I talked about this one, and to achieve better effective response to our approach to COVID is a collaboration between, let's say, the health system, collaboration between the institutions and the individuals. So it's a matter of being open to know who are your contacts, because I cannot be able to easily identify your contact if you do not tell me. And let me just say that There's an example which we have actually seen in Greater Accra. A company, let me not mention the name, it's an auto company. They had 10 positives. The 10 positives, they actually, because they went ahead to do, they called a private lab. The private lab came to do the test, and then they put the whole results in an envelope. And as far as the company is concerned, it's only 10, so it has no regard to anybody else who has been exposed. And this is a precursor for more infections. And there's a similar situation that occurred in another bank, whereby as much as 34 people were actually positive. And the health system were never informed about how to do it. And I think that what happened is that these people manage the cases as if you are managing malaria. So until the case gets complicated, the health system is not aware. And I think that to me, if you look at the case fatality for COVID, Ghana's situation is not bad. What we need is our early report, and the effective report. It's about openness and transparency in our approach. And I think that we can be able to handle the challenges we have in the country. So thank you very much.
Thank you. Dr. Aboagye, thank you for that outline. And when you say the health system is not aware, you mean the public health system. Colleagues, it's important we get this clarification so that we can explain it well to our audiences. That it is okay to test in a private lab, but if the private lab does not properly populate the full database of contacts, etc., and the public health system is not aware, tracing and doing this enhanced surveillance will become difficult. The specific person may be treated, but that person may have passed it on to other persons. And so now there are some things that are being introduced to ensure that the private labs in particular that are also testing populate data that enables the public health system to be aware and to contain any potential spread. I want to invite Dr. Patrick Aboagye to come back to the podium to explain those ones as he adds his concluding comments. And then I'll go back to the graph on the airport testing, and then we'll take some questions. Doc, so what are we doing to ensure that this second level challenge, which initially was helping to solve the problem, introducing more private labs, but the challenge that has come with it, what are we doing to ensure that now that can be contained as well?
Yeah, thank you very much, Honorable Minister. Just to recap, the two main issues is the fact that the non-adherence to the protocol. And when people get positive and they are outside the system, an organization decides to manage it. What they do is that the organization is very interested in only their office. All those of you who are positive go home. They don't know that others who may have been in contact are going to turn up positive later. But nobody cares about where these people have come from, the church they attend, the gym they go to. It is these things that when we know, at our contact listing from the person, we get to know the gyms they attend, the churches they attend, who they have come in contact within a very certain period, so that we can quickly contain the disease. And that is what is clearly missing. And so based on that, a couple of strategies have been adopted. We will continue with our regular briefing, not only in Accra, but in the regions and the districts, to let people know what is going on so that the awareness remains the same. Sometimes you go to places, they say, oh, COVID is only in Accra, COVID is asleep, COVID is gone. It is not gone, it is there, so we need to strengthen that. We want to, we start from here with our stakeholders and our chiefs, our pastors, etc., to be advocates. Not just to tell people to wear masks, but also to wear masks themselves, as an example. So they should wear and also encourage others in all scenarios to wear the mask. Because if you don't wear the mask, contact tracing, I mean social distancing, I may decide to stand here. If he decides to come next to me, I don't have control. So mask is seriously important that you don't have that. We want to work towards a special campaign, special advocacy to ensure that people get back to wearing masks across the country. In the walk-in test, as Dr. Aboagye mentioned, these are major fault lines for us, because people are getting tested and then they go home like they've gone to do typhoid test or malaria test. Some of them are telling them, oh, go home and take this tablet and rest. But that put all of us at risk. So we want to align all labs to designated GHS facilities where they'll be linked immediately, so that all results are sent there and they'll be able to quickly try. You see, when you are positive, it's not because you are not sick, go home. You need to do what we call triaging. Are you diabetic? Are you hypertensive? Are you asthmatic? Do you have any condition? That means your condition may change immediately. There are people during COVID, that's when they realized they were diabetics. That's when they realized they didn't even know. Okay, but they were healthy, working around. So that is extremely important. And we want to ensure that the lab results, whether it's positive or negative, is sent there. I have a friend who was supposed to have come in contact with somebody on Friday. Just went. Then the HR manager calls him. Oh, the woman you came to see is positive, so go and test. And this person on Saturday morning goes to test. Definitely he'll be negative. But that is not, because you don't transmit within, a minimum is about 2-3 days. So if you go on Friday and test, you are negative, you are happy, you go home, it's a problem. So we need to get these things right. We want to have a stakeholder meeting with all of the testing sites to ensure that we streamline things. We want to establish additional sample collecting sites in Accra so that we can have more control and have more information. 2 will be in Accra and 1 will be in Tema, so that we can be able to test and take all the information we want. We are going to repost surveillance officers in all these labs so that the initial information is taken from every potential person who has come there, whether you are exposed or you are traveling and you are going for a testing view. But even those who walk into the lab and want to travel, they are positive, nothing happens. They get positive and all they do is, okay, you can't travel now. But there's a lot that has to be done. Some of them have come from other parts of the country. We need to link up with the districts there to be able to do immediate follow-up. We are working towards building our capacity to sort of intensify our contact tracing, because as it is now, it means that we are going to have to do more contact tracing. If you have on the average 11 contacts, which is what you normally have, 11 contacts per case. If you have 1,200 cases, it means you are looking at about times 11 average contacts that you're going to follow up, and that requires more resources. We're going to work with other agents, including using some commercial organizations that will help us to be able to do a rapid contact tracing quickly. We want to ensure that those who are sick and at home, we have a special package, and we visit them more often to see that they are complying with this, and also they're getting better, because that's a significant number of our people are being managed at home because they are all asymptomatic. So in conclusion, ladies and gentlemen, there's a need to adhere to the safety protocols, especially the face mask, and ensuring the enforcement of safety and social distancing protocols. The media is crucial in this exercise, especially now that we are approaching Christmas. People are going to come here to buy and go, and that could be a source of another movement from cases from Accra to other parts of the country. So what we do in Accra is important to save the nation. So, Honorable Minister, thank you very much.
Thank you very much, Director General of the Ghana Health Service. Just want to highlight what I consider 2 big policy announcements that you have made. Maybe the way you said it just went under the radar. But 2 big policy announcements. The Ghana Health Service is now creating additional sampling or sample collection centers on your own, so that you can get a firmer grasp on the issues. This is beyond your public labs and then the private labs. You are creating additional sample collection centers. Where are they being located?
We're having one Ghana East, we'll put one at Ridge and then Tema General Hospital. These are not labs, but these are opportunities for people to go and have their tests done and then be taken to the available labs, both public and private labs, for testing.
So that there, in terms of the databases, you can get a whole database populated properly, and then if there's something, you know how to trace it.
Then the linkage is clear, that once you are positive, even somebody who is a contact, who is negative, doesn't mean that's the end. Some of them, based on the level of contact, we need to follow and take the sample a week or so later to be sure that they are clearly still negative.
Okay.
And some of them will have to be quarantined or isolated.
Yeah, so that's one big policy announcement you've made. The other, if I got you correct, is that you are posting surveillance officers to all of these private labs so that they can help ensure that all the necessary data is collected at the time people are doing their private tests, so that if there is an issue, the contact tracing is easier. The full exhaustive list of contacts is easier to accumulate, and then the contact tracing is easier and is better. I don't know if I got you correct.
That's correct, yeah.
Okay, I think it's a very, because then it changes the game. That people don't just do their own private test and say, okay, I'm not well, so I'm going home. But then the other complementary aspect, which is getting the entire database for contact tracing, is done clearly. Doc, we thank you for this detail. I'll ask my colleagues to set up the microphone so that we can prepare to take some questions in either language and or in any of the languages, and we'll do well to do a summary, I think, as we answer the questions. Now, please pay attention to the data given us by the Ghana Health Service from the Kotoka International Airport. 63,628 passengers have come through so far. If you net out those who don't have to be tested, 53,659 have been tested, out of which 178 are positive, 53,481 turned out negative. These positives are people who had a negative PCR test or presented a negative PCR test results taken at least 72 hours before they boarded. Somehow, between that time and the time they arrived in Ghana, they turned positive. This is evidence that the airport testing is critical and is important. There are those who make this argument that it's not necessary, it's just an intrusion, it's just too expensive, blah, blah, blah. But I'm sure you all remember what the 2 index cases did to Ghana. 178. So you have one of two options. Either you close your airport in perpetuity, especially now that there's a second wave in Europe, or you open, but you do this 2-layer test. And this is what our second layer test has managed to arrest and has saved Ghana from 178 people who had initially tested negative PCR. Within 72 hours when they arrived in Ghana, the antigen test found them to be positive. And they have been managed, or they are being managed by the Ghana Health Service. I think there's critical information that explains that this airport antigen test is important, because it allows you to strike a balance between either you keep your airports closed or you allow a general influx of cases. But this is what is helping to ensure that you can open the airport, but you can arrest any potential carriage of the virus into Ghana. And the detail is in the next slide, which I think should cause all of us to pay some more attention. 46 cases in the whole of September. You recall at our last briefing, we mentioned here that we'll be monitoring closely what is happening at the airport to make a determination of even the land borders, etc. So 46 cases in the whole of September. As the second wave that we spoke about in Europe, etc., is kicking in, 98 in the whole of October, and already 1 week in November, 34. If you extrapolate by 4 weeks, assuming the trend continues, that's about 100 and something that you're expecting, if not more, in November, because of the second wave. So do you just close your airports, or do you now do this double layer test, which allows you to have the airports open, but you manage the risk? Then let's go to the next slide, which gives us some very critical detail for policy making. The next slide. And we are noticing that the biggest cases are coming from USA, UK, Nigeria. And it informs policy as to whether you will, for example, around your West African sub-region, whether you have a basis to open the land borders immediately, looking at the kind of data that is coming in, or whether you should even revisit your policy on some of these countries that are having a wave there. Just important to highlight it so that as you do your analysis with your audiences, it's clearer to you. Colleagues, the microphone is ready. Those who have questions, we'll take a first batch of 4. First batch of 4. Yes, sir. 1, 2, 3, 4. Okay. So, and we will take it in twos so that we don't.
So my name is Kweku Asante from JoyNews. The political parties, including the New Patriotic Party, have been holding events that can be likened to super spreaders events with little or no adherence to the preventive protocols. Why are you, and by you I mean politicians, including those of you in government and those in opposition, not owning the responsibility that you could be part of why there's a certain surge in new cases? And then what exactly is government doing? Now that we have less than 30 days to election, where some of these actions, political rallies, walks, and other things are going to be intense? That's the first question. The second question.
So this is addressed to me, right?
Anyone that can answer that.
Because he said, why are you the politicians? He's not a politician.
So
that's what I'm asking.
after that, he will take the charge on what government is going to do in terms of the Ghana Health Service. Steps that will be taken to limit some of these things because the actions are taking place. The second question is, what is our current testing capacity? Because a researcher from the University of Ghana's Aboagye actually noted on our show last week that our testing has now shifted from the previous aggressive contact tracing to now people who are sick, and then we contact trace around those people, and then that is it. Other than
so let me see if I understand you.
Yeah.
What is our testing capacity?
Now.
Relax.
Yeah.
Or has our testing policy changed? There are two different questions.
Yeah, in one.
Okay, so Doc, so what is our testing capacity? Has it gone up? Has it reduced? And has our testing policy changed? Yeah. Those would be about two different questions. Thank you. What's your name again?
Kweku Asante, JoyNews.
Kweku, thank you. Yes, sir.
Sorry. Okay. Joseph Armstrong with TV3. So just as you said, the first question about politicians and why we didn't hear anything about activities of politicians and their contributing factor to the spread of the COVID-19. And also, let me quickly ask, this morning I was at the Airwax Sports Stadium where we have this treatment center. The place has been left and Bush has taken over the place. We're asking, are you still going to do anything there? And then also, is Noguchi still testing? We know the Legal Medical Center have stopped receiving COVID-19 patients. Now that we are having rise in the numbers, are we going to ask some of these hospital facilities to start